So this video we'll be talking about how to interpret scores from the ASIA scale. But before I get into that, I mostly just wanted to define what sensory levels and motor levels are. So sensory levels and motor levels are the lowest spinal cord levels where the scores at all levels above them are normal. For sensory, that would equal 2. For motor, that would equal 5. And then just because the motor levels can get a little confusing sometimes, I have an example written out right here. So this is assuming that C1 through C4 motor function are all 5, which would be normal. So C6 right here, everything above it is normal. Everything above it is normal. So we established that as the motor level. And it's not 3 because everything above that isn't quite at the normal level. There's still a 4 here. And then for 2 at T1 right here, this isn't able to kind of move through full range of motion against gravity. So if C6 was 2, then the motor level would be 5. But because C6 is at least a 3 out of 5, then C6 is the motor level. So getting into the ASIA scale here, I tried to break it up into at most 2 categories for each level. So starting with A, if there is no S4, S5 sensory or motor function, then it's an A. But if there's S4, S5 only sensory function, and there's sensory function below the NLI, and there is no motor function greater than 3 spinal cord levels below the motor level, then it's an ASIA B. So if a patient has a C5 injury and they're an ASIA B, they may have some motor sparing at the C6, C7, or C8 levels, but not at T1. Then for ASIA C, they have both sensory and motor function at S4, S5, and that's the case for C through E. However, where it differs here is for C, there's motor sparing greater than 3 levels below the motor level, which differentiates it from B. But for C, greater than half of the manual muscle tests below the NLI have a score of 0 to 2 out of 5, whereas for D, over half the manual muscle tests below the NLI have a manual muscle test score of 3 or higher out of 5, and then E is just normal. And then related to the ASIA score is zone of partial preservation. And just what zones of partial preservation are is the lowest spinal cord segment below the motor level or sensory level with any preserved function. And for a zone of partial preservation to be in place, there cannot be any sensation or motor function present at S4 or S5. So if there's no sensation present at S4 and S5, then there would be no sensory zone of partial preservation. But if there's no motor activity present at S4 and S5, there would be no motor zone of partial preservation either.